Hello, everybody. My name is Eli Novosolov, and today I'll be presenting on stress and anxiety disorders. Now, I know we've all experienced stress before. Personally, I've had stress before an exam, a wrestling match, or just in general in life, I get stressed. But there are a lot of people in the world that deal with it as a disorder, and so today I want to be touching a little bit about, the strength, how stress and anxiety disorders work and how they affect people. In this presentation, I'm going to explain what stress and anxiety disorders actually are, what happens inside the body, and how they impact exercise performance. And then also I want to talk about how exercise can actually serve as a form of treatment. I'll go through a sample case study and share a evidence-based exercise prescription. So I want to talk a little bit about what even stress and anxiety is. Stress is the body's short-term natural reaction to a challenge or a threat. And so it's a good thing. It helps us push through difficult situations like giving a presentation, for example, or middle of a workout. It's hard trying to push through. But anxiety disorders is when that stress actually becomes a chronic response. So that's when stress is actually persistent and it impedes on how a person functions daily. Some common examples of this is general anxiety disorders, GAD, panic disorder, PTSD, social anxiety disorder. There's also OCD. These conditions can range from mild to completely disabling. And as a future hopeful professional, I'll need to be able to recognize these problems and have a plan in terms of how I prescribe exercise to that specific patient if they are dealing with stress and anxiety disorders. Now, I want to talk a little bit about how actually prevalent this issue is. And so according to the National Institute of Mental Health, about 19% of U.S. adults experience an anxiety disorder in a given year. So just to put in reference, that's 1 in 5 people. Women are about twice as likely as men to be diagnosed. This is partly due to hormones and just social factors. The typical age of onset is from the teen years to the early 30s, meaning it often affects college-age individuals. Rates have also been rising among college student athletes due to just pressure to perform. Social media has a huge influence. There's also academic competition, and understanding all of these is what's going to help us design exercise programs that not only improve fitness but also promote a patient's mental wellness. So physiologically, inside the body, stress activates 2 systems, the sympathetic nervous system and the HPA axis. HPA axis stands for hypothalamic pituitary adrenal axis. This response releases hormones like cortisol and adrenaline, so that would prepare the body for fight or flight, which is a good thing, usually. And that's when heart rate would increase, blood pressure rises, and energy storage releases glucose. Now, like I said, it's a good thing because it's meant for adaptive purposes. It's meant for healthy individuals to be able to adapt to certain situations. But when these symptoms stay for too long, which is chronic anxiety, the constant hormone release can cause fatigue, impaired immunity, inflammation, and it could decrease muscle recovery. And so over time, this will contribute to a lot of mental and physical health issues. 3 main categories of these symptoms. There's physical symptoms, which would include rapid heart rate, rapid heartbeat, muscle tension, sweating, and fatigue. These often feel like they're being on the edge all day, constantly. Some psychological symptoms include excessive worry, racing thoughts, irritability, or difficulty concentrating. This can affect school, how you perform at work, or if you're an athlete, how you perform on on the field, on the mat. And behavioral symptoms might show up as avoidance of stressful situations, disrupted sleep, or withdrawing socially. And each person will have to deal with, or deals with, like either one of these or a combination of a couple of these when they deal with stress and anxiety disorders. And so that's why individual assessment before signing a program is extremely vital. I want to talk about how it affects their exercise response. So when it comes to exercise, stress and anxiety can significantly influence performance. People with anxiety often start with higher resting heart rates and blood pressure, and they may experience faster fatigue or slower recovery. Chronic stress, so like what I was talking about before, elevates cortisol, which can reduce protein synthesis, slow muscle repair. It can also affect motivation and adherence. And adherence is extremely important. I'm gonna circle back to that, but it's extremely important in any health professional's field, because if the patient is not compliant and is not adherent to the program or the medication, it's not going to work. And so when people lack motivation and adherence, they skip workouts, or they're just simply too tired to go. And now I want to talk a little bit about how exercise will actually help a patient. Exercise helps lower cortisol, heart rate, and blood pressure, and boosts mood by releasing endorphins and serotonin. And these are our natural feel-good chemicals. It also improves sleep quality and reduces muscle tension. Aerobic exercise, such as walking, cycling, swimming, has extremely strong evidence for reducing anxiety. And activities like yoga or Tai Chi would actually add a stress management component, because it focuses on breathing and being present, mindfulness. Even as little as 20 to 30 minutes of moderate exercise most days can create noticeable psychological improvements. Many clients with anxiety are on medication, which can influence their exercise response. SSRIs like sertraline are commonly prescribed. These may cause fatigue or mild nausea, especially early on. Benzos, such as Xanax, can create drowsiness or slower coordination, increasing the risk of falls or injury. And then you have beta blockers like propranolol, reduce heart rate response during exercise, making heart rate-based intensity unreliable. So usually when that happens, a professional should use the RBE scale, which stands for the rate of perceived exertion. And here is a sample case study that I've created. The client is a 20-year-old female diagnosed with GAD, generalized anxiety disorder, who takes sertraline. She has a sedentary office job, reports of high daily stress, and wants to improve her mental and physical health. So it's very critical that she was, in fact, cleared by her physician for exercise, and our main goal is to reduce her anxiety, improve fitness, and build long-term adherence, like I said previously, through positive experiences with exercise rather than adding pressure or competition. For testing, I wanted something light so that she stays calm and it's not too intimidating for her. So for aerobic fitness, I wanted to do a 6-minute walk test because it's submaximal, it's low pressure, and it still provides pretty measurable data. For strength, I decided on an 8-rep max bench press and leg press so that we can gauge where her muscular endurance and power is. And then for flexibility, I decided on the sit and reach test because it's easy and it will help us assess hamstring and lower back flexibility. I'd also possibly add a mindfulness stress scale because she's dealing with stress and anxiety disorders. So this will be used before and after testing just to see where she's at mentally, see if she's made any improvements. For her exercise prescription, aerobic training 3 to 5 days per week at 40 to 60% of heart rate reserve, or RPE 11 to 13 for 30 to 45 minute sessions or per session. Good options are walking outdoors, cycling or swimming, activities she enjoys and finds calming, which is again most important because adherence, consistency. For resistance training, 2 to 3 days per week at 60 to 70% of 1 rep max, 2 to 3 sets of 8 to 12 reps, using large muscle group exercises. Full body workouts with machines or light free weights work best early on. For flexibility in mind and body, at least 3 days per week for 10 to 15 minutes, focusing on gentle yoga, stretching, or breathing exercises to end sessions on a relaxed note. So the key again is consistency, not over pressuring the patient, but if she's consistent, she will see gradual progression. And so her adherence is number one importance when applying this exercise program. When working with anxious clients like this one, environment is really critical. So avoiding overly competitive or crowded gyms that might increase stress is really important. I wanted to choose, you have to choose rather calm settings, something like a small studio or a park, an outdoor environment where she's feeling okay, or he or she. Group classes might also be beneficial because she'll be with somebody, like a partner, even not just group classes, but partner work, because you have someone to piggyback off and you have that support. Using the RPE scale is also very good because her heart rate's going to be kind of off because of her stress and anxiety. So RPE is a pretty good way to block where she's at, and it's a good way to test where her dizziness, panic, or shortness of breath is, if she has any, or chest pains. And again, as professionals, the tone and attitude you bring is really, really important. And as you're guiding this patient through their exercises, it's really, really important that you remain calm yourself, extremely encouraging. And if that's the way you act around the patient, they will really, really benefit as well. Smith et al. States that 12 weeks of aerobic training reduced general anxiety disorder symptoms by 35%, which is a really, really, really significant improvement. Jayakoda 2020 found that yoga not only decreased anxiety but also improved sleep quality, which is often disrupted with patients like this that deal with stress and anxiety disorders. And according to the ACSM, American College of Sports Medicine 2021, achieving at least 150 minutes of moderate exercise per week is enough to lower stress-related hormones and boost mental health. To wrap up here, stress and anxiety disorders have mental and physical effects. Chronic activation of stress pathways leads to fatigue, poor recovery, and long-term health risks. But with exercise, we're able to offer a natural and safe and powerful way to help. It normalizes cortisol and heart rate levels. It releases mood-enhancing chemicals and restores balance between the mind and body. Mind and body. When combined with medications or counseling, a well-designed fit plan becomes a cornerstone of anxiety management. And as future professionals, or anybody in that field, we have a really good opportunity to help people, not only physically, but feel mentally better. Here are my references, and I hope you guys all learned something and enjoyed, and have a good rest of your day. Bye-bye.